Welcome back to the channel after the weekend. Hope you have a good weekend. So we have started with candidiasis and type of candidiasis. We have dealt with pseudomembranous candidiasis. Then we have dealt with atrophic candidiasis, in which there was angular cheilitis and medium rhomboid glossitis. And then we have dealt with hyperplastic candidiasis. Now we'll be starting with the next type of candidiasis. Let's start. Okay. The fourth type is mucocutaneous candidiasis. It is the most serious form of candidiasis. It suggests a systemic distribution and a more extensive degree of host defense compromise. Okay, this mucocutaneous candidiasis include the systemic distribution, and it shows the degree of host defense compromise, and it is the most serious form of candidiasis. Present with a pseudomembranous oral presentation, will also show skin, esophageal and nail involvement. So there is a pseudomembranous oral presentation, but it will also involve skin, esophagus and nail. Okay, nail involvement will be particularly prominent. तो सबसे ज़्यादा prominent क्या होता है? Nail involvement. The nail bed will be destroyed and the nails are disfigured. तो nail bed destroyed होते हैं and the nails are disfigured. Okay, there are several proposed etiology for mucocutaneous candidiasis. The one is the predisposition for the infection, which is the result of an autosomal recessive inheritance. तो ऐसा बोलते हैं कि they are already predisposed to infection because of an autosomal recessive inheritance. 50% of these are associated with endocrinopathy, consisting of either hypoparathyroidism, hypothyroidism, addition type of adrenal cortical insufficiency और diabetes mellitus. सो इनमें से क्या होता है, जो 50% होते हैं दे आर एसोसिएटेड विद एन एंडोक्राइनोपैथी. तो इनमें से कोई सा भी एंडोक्राइनोपैथी से दे कैन बी एसोसिएटेड. एंड थर्ड इज सेल्युलर इम्यून डेफिशिएंसी. So mainly the host immune defense system is compromised and it has a systemic distribution. क्योंकि systemic distribution है इसलिए it is the most serious form of candidiasis. The candidiasis seen in AIDS patient and those with HIV patient not yet progressed to AIDS is essentially a mucocutaneous form. सो जो एड्स और HIV इन्फेक्शन में कैंडिडियासिस दिखता है तो दे आर नॉट एसेंशियली अ म्यूकोक्यूटेनियस फॉर्म. First, they are seen on oral mucosa, but they may become disseminated to involve skin and even internal organ. पहले तो oral mucosa पे दिखेंगे, but after that they disseminated to involve skin and even internal organs. Now, there is a last type of candidiasis which is known as disseminated candidiasis. Okay, coming to disseminated candidiasis is not commonly seen in oral and maxillofacial region. So we as an oral and maxillofacial surgeon, we doesn't, or as a normal dentist, we doesn't see most commonly this type of candidiasis. It may result from a mucocutaneous candidiasis क्योंकि अभी हमने पढ़ा था कि वो disseminated होते हैं. That has invaded through skin or mucosa to seed the bloodstream, a condition more probable in immunocompromised patient. Obviously जो immunocompromised patient होंगे उनमें through the skin or mucosa bloodstream में वो seed कर देंगे, तो they give the form of disseminated candidiasis. So mucocutaneous candidiasis turn into disseminated candidiasis, or it may also be seen as a complication of long-term indwelling catheters such as central intravenous line, a subcutaneous port, or even a urinary catheter. So it is also associated with a complication of long-term indwelling catheter. या तो सेंट्रल इंट्रावीनस लाइन है, या सबक्यूटेनियस पोर्ट है, या नॉर्मल यूरिनरी कैथेटर है. Okay, that's all about the types of candidiasis. Next class we'll be starting with the differential diagnosis. Till then, like, share, subscribe, and comment. Bye.